having me. My name's Sam Roberts, and I've got two jobs. One is the Director of the Innovation, Research and Life Sciences at NHS England and Improvement, and then the other is I'm the Chief Executive of the Accelerated Access Collaborative, which is the umbrella organisation for innovation across health and government. So neither of those job titles are particularly illuminating, but what I thought I'd talk about is some of the background to what Gary talked about. So why we thought identifying research and innovation needs was a priority, what we're thinking about the innovation landscape, then a little bit about the work. We've done similar work to this nationally, and the way we've gone about it and things that we found, and then a little bit about my hopes for what comes out of today. So we went through a process within our NHS England national programs, cancer, mental health, primary care, et cetera, to say what are your big research and innovation needs. And we worked with NIHR on this. And what we ended up finding was that about 50% of the research and innovation needs that we identified were either being addressed by NIHR or were partially being addressed, but the scope of the project could slightly be modified, or NIHR introduced new calls. So I think that kind of led to quite a sense of comfort in NHS England, that actually there's a nice dialogue between policymakers and NIHR, that we are actually focusing on things that are important. So then the next thing we thought was important to do is to say, well, just because we as a policymaker, just because the National Clinical Director of Cancer thinks that something's important, doesn't necessarily mean that the radiation oncologist at the John Ratcliffe thinks it's important. So we thought it was important for the AHSNs to work with their local areas to say, are the kinds of things we came up with nationally the things that you think are important or not? And whilst there was some overlap between the things that the AHSNs came up with nationally so what we came up with nationally and the AHSNs, there was certainly a far greater focus on, I think, multi-morbidity and workforce challenges in the local research and innovation needs survey. So I think, and if you were to go a level down from that and do research and innovation needs at an organization, you'd probably find a slightly different picture, and if you do it at a clinical team, you'd probably find a slightly different picture. So I really appreciate the fact that you've given your time to say, right, we've got the high-level domains, what actually is within this? So what is the actual question around multi-morbidity? Yeah, we know it's a big problem. What is the question that we want answered? And I think that's the purpose of today. Now, this work is pretty central to what we think our role is in NHS England and Improvement on research. We work with NIHR and UKRI on two big things. So one is trying to make the NHS as efficient as possible at undertaking research. And then the second is ensuring that that research meets the needs of patients, the public, and NHS staff. So you can clearly see what we're doing today falls into the latter camp, right? It's understanding needs so that we can commission the research that we care about. Then on the former camp, over the last year, which is improving efficiency of research in NHS, in the last year, we've focused mainly on kind of some of the boring plumbing of research, right? Excess treatment costs, changing the way that they're allocated. Hopefully you guys think it's better than before. Simplifying costing of commercial contract research, hugely controversial, but still being implemented. And those are our priorities that we decide together with NIHR and other folks in the research ecosystem in this meeting called the UKCRC, where industry and others say to us, these are the important things for research. Research funders, the welcome, et cetera. So our next phase on that, improving efficiency in research, will be actually, I think, pretty interesting for those of you who are interested in trials, probably interesting for anybody who's a researcher here, is can we develop some kind of national consent to contacts approach? And how can we link that with a national find and recruit approach for clinical trials? So we're investigating different avenues, like can we use the NHS app to support consent for contact? How do we work with NHS Digital on find and recruit and those sorts of things? So that's one bit of the job is research and obviously working with the major research funders, where you can see what you're doing today is a key part of it, so we're very grateful. The second part of the job is innovation. And we've got two big priorities on innovation. So one is making sure that we develop a pipeline of proven innovations that meet the NHS's needs, which is kind of what we're looking at today as well. And then the second is making sure that we adopt and spread those innovations. So about 5 months ago, the innovation ecosystem at a national level had a bit of a shake-up. The Secretary of State came in and he looked at this. What he decided to do is to take a pre-existing board, which is called the Accelerated Access Collaborative, which was set up following the Accelerated Access Review. It's chaired by Lord Darzi. It's got the chief executives of all kind of the major players in the innovation ecosystem there. So we've got Simon Stevens from NHS England, we've got Andrew Dillon from NICE, we've got Chris Whitty from NIHR, et cetera, et cetera. And he said, could we not say that this board now, this partnership, is responsible for the innovation ecosystem in its totality? So that you guys can't, as individual organizations, go away and do your little bit on this and your little bit on that, but actually we work together on a set of priorities. And so there were two kind of groups of things he asked us to do. The one was to consolidate some of the innovation programs we commission. So one is the AHSNs, NHS Innovation Accelerator, test beds, SME Real World Evidence Fund. We've got all of these funny little not funny little, I mean, AHSNs are huge, but innovation programs that we fund. So he said, could you bring them all into this Accelerated Access Collaborative so you could commission them together and make sure they link together? But then the second thing is he said, well, when I look across the innovation ecosystem, it feels like we're missing 6 things to make it work together properly. The first is a joint horizon scanning function. We don't really know what's coming, right? So how can we plan for it? And that's as important for MHRA and NICE as it is for us in the NHS. The second priority was what he calls demand signaling. That is exactly what you're doing today, saying for local people that work in the service or researchers that have got deep experience in their local patch, what are the needs that we have from innovation? So historically, we've been really supplier-driven on the innovation side. Somebody's come up with a good idea, and then we've absorbed it into the health service. I suppose his challenge to us is to say, well, can't you be a little bit more of an active consumer? Can't you say, no, actually, these are the needs that we need to be fulfilled, and then work with innovators to develop innovations to support that? So that's why kind of what you're doing today is such a crucial part of that puzzle. So we've got horizon scanning, demand signaling. The third is this idea of a single front door for innovators to provide a resource, both human and online, that helps innovators navigate the innovation ecosystem. The fourth is expanded real-world testing. The fifth is stronger support for adoption and spread, which obviously the AHSNs lead. And then the final one is changing reimbursement mechanisms and procurement. So when this kind of cross-body juggernaut was created, I was delighted to be appointed its chief executive, so that's what the second title is. So I've got my job in NHS England and then this other job. So to kind of bring this together about why we're here today, you can see what you're doing supports both of the big things that we care about, right? One is on the pure research side. We really, really, really want to make sure that research funders are prioritising the things that are important to your patients, public, clinicians, and other NHS staff. And then on the other side, with innovation, we really want to work more actively with innovators to make sure that they are meeting the needs that you face rather than us just absorbing things that somebody else may have thought was a nice idea. So that's the purpose of today. Things that I'd like to get out of it, and I think that are pretty realistic given what we've done at NHS England, are one, I think there'll be one category of thing where you say, oh, this is a pretty interesting research question, but actually when NIHR does their portfolio review, we'll figure out actually somebody's already studying it or has studied it. So there'll be that group of things. There'll be another group where we say, oh, this is a really interesting research question, and actually we need to go further. We need to figure out whether we can modify an existing program or ask for a new call or something like that. So those are the two things on the research side. On the innovation side, you may find that you're really interested in innovations in virtual reality for depression and other diseases. So can we do some horizon scanning for you to understand what's in the pipeline? Where is it being deployed? How far is it developed? So that's the the first bit on innovation. And the second bit would be, we fund a large number of innovation programs, everything from SBRI through to testbeds through to AHSNs. So can we be a bit more purposeful in how we spend our money? If you say, yeah, virtual reality and depression is a priority for me, well, why don't we have an SBRI call on that? So I suppose those are the 4 things that we want to get out of it today. The last thing that I'd say is, this is the first time we've done this. Right, Gary's taken amazing kind of national leadership in getting the whole AHSN network to do this and pulling together this fantastic event today. So huge appreciation to you, Gary. I can not think of many people who could have pulled it off, so thank you. Undoubtedly, today will be imperfect. But the thought I'd like to leave you with is, this is the first time we've done it. This is the first time we've tried to be active consumers of innovation. This is the first time we've from all the different partners, try to actively influence research spending. So it may not be perfect, but it's a pretty great start. So thank you very much.